shoot, what was that? Anyways, can you please taste the candy for me? Taste sour. Sour? Alright, patient correctly identified the sour taste. Cranial nerve 7 is intact. Also correct to say with the facial movements, cranial nerves 5 and 7 are intact. Next I'm going to palpate your sinuses. Let me know if there's any pain or tenderness when doing this. No. Any pain or tenderness? No. Alright. No pain or tenderness upon palpation of bilateral frontal maxillary sinuses. Next we're going to check out your eyes. So just by looking at them, I can see there's no scleral icterus or protrusions noted. Next, we're going to do the 6 fields of gaze test. I'm just going to have you look at this, the tip of the pen light, and follow it through the 6 fields of gaze. Just keep your eyes focused on it and try not to move your head. Alright, eyes move smoothly through all 6 fields of gaze. No knife sadness noted. Cranial nerves 3, 4, and 6 are intact. Next, I'm just going to take a look at your pupils and note they're 4 millimeters bilaterally before light is introduced. Next, I'm going to introduce some light into both of your eyes. Alright, and now they have constricted to 2 millimeters bilaterally. Next, I'm going to ask you to look at an object in the distance. And then focus your eyes right here on this pen light. And then I'm going to bring it close to your head. Just focus your eyes on it. Alright. Pupils are 4 millimeters bilaterally before light is introduced. Pupils constricted to 2 millimeters bilaterally after light was introduced. Pupils are equal, round, and reactive to light and accommodation. Cranial nerve 3 is intact. Next, I'm going to take a look at your red light reflex. For this, I'm just going to have you look straight ahead, and I'm going to take a look at your red light reflex. Okay. Red light reflex is intact bilaterally, or is present bilaterally. Next, I'm going to inspect your ears, and then I'm going to palpate them. Let me know if there's any pain or tenderness when doing this. No. Alright. Bilateral auricles. Reveal no arrhythmia or crusting, no pain or tenderness upon palpation of bilateral auricles. Next, I'm going to do the whisper test. So I'm going to stand on this side of you. Can you please include your left ear for me? Alright, I'm going to whisper 3 words and just repeat them back for me. Okay, I'm going to come on this side, and if you'll include your right ear for me. 1, 2, 3. Alright. Patient correctly repeated the 6 whispered words. Cranial nerve 8 is intact. Next, we're going to do the Weber test. For this, I'm going to strike the tuning fork, put it on top of your head, and I need you to tell me where sound is heard best. Sound heard equally in both ears. No lateralization noted. Next, I'm going to take a look inside your ear. For this, I'm going to pull your pin up and back. Bilateral ear canals are patent. Bilateral external ear canals reveal no excessive cerebral foreign bodies, edema, and discharge. Tympanic membrane is intact, translucent and pearly gray, and cone of light is visualized at 5 o'clock on the right side and 7 o'clock on the left side. Alright, next we're going to move on to your face and your nose. So just by looking at your nose and inspecting it, I can see that it's midline. Next, I'm going to take a look inside it. Okay. Next, I'm going to have you occlude one of your nostrils and breathe in. Alright, can you occlude the other nostril and breathe in? Alright, so nose is midline and bilateral mirrors are patent. Next, I'm going to have you close your eyes, and I'm going to place an item in your hand if you'll just smell it while occluding one nostril. Oh, here's that object, and you can smell it. What's the smell? Alright, go ahead and occlude the other nostril, and then you can smell the item. Alright, patient able to correctly identify the scent in both nostrils. Cranial nerve 1 is intact. Next, we're going to move on to your face and your mouth. If I could just take a look inside your mouth. Alright, and if you can lift your tongue up for me. Alright. Hard palate, buccal mucosa, uvula, soft palate, posterior pharynx, and tongue are all pink and moist. Frenule is intact. Uvula is midline, and tonsils are 2+ and present. Next, I'm going to take a look at your teeth. Alright, and if you can open up. Alright, teeth are white and of good hygiene. No dental caries noted. Next, I'm going to have you state light, tight, dynamite.
Light, tight, dynamite.
Alright, patient speech is clear when stating light, tight, dynamite. Cranial nerve 12 is intact. Next, I'm going to have you swallow for me. Alright, next I'm going to assess your gag reflex. Alright. Next I'm going to have you open up and say ah. Alright. Patient able to swallow on command without difficulty. Uvula and soft palate rise and fall symmetrically when the patient states ah. Cranial nerves 9 and 10 are intact, and gag reflex is intact. Alright, next we're going to move on to your neck. First, I'm just going to assess your trachea and make sure that it's midline. Alright, next I'm going to palpate your trachea. Let me know if you have any pain or tenderness when doing this. No pain or tenderness? Alright. Trachea is midline. No pain, tenderness, or mass is noted when palpating the trachea. Next, I'm going to feel for your lymph nodes. Let me know if there's any pain or tenderness when I do this. Preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, deep cervical, posterior cervical, supraclavicular. Any pain or tenderness?
No.
Alright, all lymph nodes are non-palpable. No pain or tenderness when palpating the lymph nodes. Next, I'm going to palpate and auscultate for your carotid pulses. First, I'm going to just feel them one at a time. Alright, now I'm going to give you just a second. Alright, next I'm going to auscultate them. When I'm doing this, I'm also going to use the bell of my stethoscope to auscultate for any breweries. When I do this, please inhale, then exhale, and hold your exhale. Go ahead, inhale, exhale, and hold. Okay? Inhale, exhale, and hold. Alright, carotid pulses are 2+ even and regular, no bilaterally, no breweries are auscultated bilaterally. Next, I'm going to move on to your skin. Just by looking at it, I can see that your skin color is even and consistent with your race and ethnicity, and your pigmentation is even throughout. Next, I'm going to feel for any of your exposed skin, just to feel the temperature. Alright. Skin color, or skin is warm and dry to touch. I'm gonna assess your skin turgor. Alright, good skin turgor, no tinting noted. Next, we're going to move on to your respiratory system. So for this, I'm just going to inspect your chest. And I'm going to look at your AP to transverse ratio. Next, I'm going to have you sit with your knees to the side right here. I'm going to inspect your posterior chest expansion. If you'll take a deep breath in for me. And out. Alright. Chest is symmetrical with no deformities. AP transverse ratio is 1 to 2, and posterior chest expansion is equal bilaterally. Next, also while I was assessing that, I also assessed your breathing, and it was even, regular, and unlabored. Next, I'm going to listen to your lung sounds. Each time I move my stethoscope, I'm going to use the diaphragm this time. Each time I move my stethoscope, just take a deep breath in for me. Alright? And out. Go ahead. Okay. Alright. Take a deep breath in. And out. Alright. Alright. Lung sounds clear in all lung fields. And upper or in anterior. Lung sounds clear in all lung fields anteriorly and posteriorly. No adventitious lung sounds noted. Next, you can sit back forward. Next, I'm going to listen to your heart. Alright. We have the aortic, and that is the second intercostal space on the right side of the sternal border. We have the pulmonic, that is the second intercostal space on the left side of the sternal border. We have the tricuspid, that's the fifth intercostal space. If you can just lift up, you don't have to, just lift up like this. That's fine. The fifth intercostal space, left side of the sternal border, but still close to the sternum. And we have the mitral, which is the left of the sternal border, midclavicular line, and fifth intercostal space. Okay? S1 and S2 were noted. No extra heart sounds or murmurs were noted. Next, I'm going to feel for a few of your arteries. I'm just going to feel for your brachial. We'll just lay your arms like that. Okay. Great. Do you mind slipping these off for just a second? And I'm going to feel the dorsalis pedis pulse. Alright. Bilateral, brachial, radial, posterior tibialis, and dorsalis pedis pulses are 2+ even and regular. Next, I'm going to assess your capillary refill. I can just seal your fingers. I'm going to hold them down for 5 seconds and then assess. Okay. I can't assess her lower extremities due to her having nail polish. Capillary refill was less than 2 seconds in upper extremities. Next, we're going to move on to your abdomen. So for this, I'm just going to have you lay back. And I'm going to bring this out. Alright, so for this, I'm just going to take a look from the side. I'm going to look at you. Alright, so the abdomen is flat and the umbilicus is midline. Next, I'm going to take a listen. I'm going to pull these down just a little bit. I'm going to start in the right lower quadrant. Normal active vowel sounds auscultated in all 4 quadrants. Next, I'm going to percuss, again starting in the right lower quadrant. Alright, tympani noted in all 4 quadrants. Next, I'm going to do superficial and deep palpation. Let me know if there's any pain or tenderness when doing either of these. So we're going to start with superficial. Any pain or tenderness? Okay, we're going to go to deep palpation now. Any pain or tenderness? Alright, abdomen is soft. No pain or tenderness noted upon superficial and deep palpation of the abdomen. Now I'm going to have you sit back up. Alright, we're going to move on to the musculoskeletal portion. For this, I'm going to start by having you squeeze my fingers for me. Alright, next I'm going to have you try to point your toes up at the sky and point your feet up, like something like that. I'm going to try to push down and just don't let me push them down. Alright. Muscle strength is 5 out of 5 bilaterally in upper and lower extremities. Next, I'm going to assess your shoulder strength. If you'll just push your shoulders up, I'm going to try to push down, don't let me. Alright. Shoulder strength is 5 out of 5 bilaterally. Cranial nerve 11 is intact. Next, I'm going to have you stand up. You can put your shoes back on. Alright. I'm going to have you look down, and then look up, and then shoulder to ear, everyone, and then turn your neck to the other side. I'm going to have you bend forward, and bend backward, and rotate the other side, and then kind of bend over like this, and then to the other side, flex your arms, and back down, and then you can do one knee, and then back down, and the other knee, and back down. Did you have any pain or tenderness? Alright. Full range of motion in neck, spine, arms, and legs bilaterally, with no pain, crepitus, or limitations. You can go ahead and, we're going to do the Romberg test now. We're going to move into the neurological assessment now. So I'm just going to have you stand there with your feet shoulder width apart and your hands down by your side. I would have her stand like this for 30 seconds with her eyes open, and then I would have her close her eyes for 30 seconds and assess, but for the purpose of this, we're just going to go ahead and move on. Next, I'm going to have you hop on one leg, and then hop on the other leg. Alright, negative Romberg, no swaying noted. The patient is able to hop on one foot bilaterally. Next, we're going to move on to, you can go ahead and sit back down. So for this portion, I'll have you stick out your hands. And I'm going to have you point them up and then back down, and then go ahead and go like that. All right. Patient's able to perform smooth and accurate movements bilaterally. Next, I'm going to use this Q-tip, and I'm going to let you know what sharp and dull touch feels like, and then I'm going to go down each of your extremities, and you just let me know if each one is sharp or dull. All right, so I'm going to do it on your leg. So this is sharp, and this is dull. Okay? All right, if you can close your eyes for me. And each time I do it, just let me know. Sharp, dull, sharp, dull. Okay, we're going to go down your legs now. Dull. Sharp. Dull. Sharp. Dull. Okay, other leg. Sharp. Dull. Sorry. Dull. Sharp. Sharp. Okay. Patient able to correctly differentiate between sharp and dull touch in upper and lower extremities bilaterally. Next, I'm going to test your stereognosis. I'm going to have you continue to close your eyes. I'm going to place a familiar object in either of your hands and just let me know what that object is. Okay, you hand that back to me. Next, I'm going to place another one. Paper cup. All right. I said patient is able to differentiate between sharp and dull touch in upper and lower extremities bilaterally, and stereognosis is intact bilaterally. Let me run through my head really quick and make sure I got everything before I say I'm done. Okay. I think I'm done.